Hi, my name is Suma Shankar. I'm in the Department of Pediatrics, Division of Genomic Medicine here at the Mind Institute. I will share with you all some of the work that we do here at Genomic Medicine, as well as our research. We are often asked, what is genomic medicine? Now, genomic medicine is a specialty that integrates the understanding of genetic contribution to human diseases. Our team consists of 5 clinical geneticists and physician scientists, as well as 5 genetic counselors. We also have a genetic counseling assistant, a metabolic nutritionist, and a CRA. We at the Mind Institute in Genomic Medicine Clinic see patients with autism and neurodevelopmental delay, cardiovascular, as well as other metabolic conditions, and have a precision genomics clinic as well. We see individuals of all ages from newborn to adulthood. Among our referrals, developmental delay and autism spectrum disorders are among the top. Individuals may come with either developmental delay or a known diagnosis of autism spectrum disorder, or they may come with a symptom of ADHD, intellectual disability, history of developmental regression, or speech and language developmental delays. We know that the etiology for autism spectrum disorder and developmental delays are complex and include both genetic and environmental factors. There are also epigenetic factors. We specialize in evaluating for genetic disorders, and our goal is to provide accurate genetic assessment so that we can provide clear prognosis, risk assessment, and direct our families to appropriate services. Our genetics evaluation is very detailed and consists of detailed history taking as well as physical examination, in addition to taking very detailed family history. We take care of the families along with our individual patients. Based on all of these evaluation, we recommend appropriate genetic testing. We know that all of our DNA that carries the genetic information is packaged within the chromosomes. We can look at the chromosomes as a whole by genetic testing under the microscope, or look at individual genes by doing either single gene testing or looking at multiple genes at once. The most comprehensive test that is available currently is whole genome sequencing, wherein we look at the entirety of all of our genetic information, including the coding as well as other regions. This is a test that is offered at very few centers around the country, and we offer it for our families here at UC Davis. As an extension of this whole genome sequencing, at the Precision Genomics program, we see individuals with non-verbal autism spectrum disorder or neurodevelopmental delay and offer whole genome sequencing without cost to the families. However, we do give test results to the families within 4 to 6 months. This would help in identifying underlying genetic etiology as well as help us with new gene discovery at times. We collaborate with the mouse biology program to make mouse models to help in this process. The mouse models are used not only to look at the clinical symptoms and physical manifestations in detail, we also can study social and behavior aspects. As seen here, the mouse is made to interact with a stranger and it interacts less, but when you introduce a new stranger, then it interacts more with the previous one. We can take all of this information and understand the role of genetics in neurodevelopmental delays. Our ultimate goal is to use this information to provide personalized care for families and patients. We also discuss some of our hard to diagnose individuals in our genomic rounds with multiple specialties such as developmental peds and neurology. We provide comprehensive care for our families, and we can be reached 24/7 on an emergency basis, or referrals can be made to the Genomic Medicine Clinic by your physician or by a specialist who sees you at the Mind Institute. Thank you all for your attention. We are always glad to answer any questions that you may ask. Thank you.
Hi, my name is Dr. Madelena Martin, and I am the director for the Metabolic and Lysosomal Storage Disease Clinics here at the Mind Institute at UC Davis. Our clinic is primarily tasked with diagnosing and managing patients with various inborn errors of metabolism or metabolic disorders. This includes disorders such as phenylketonuria or PKU, methylmalonic acidemia or MMA, and maple syrup urine disease or MSUD. We also see and evaluate as well as manage patients with various mitochondrial disorders. The Lysosomal Storage Disease Clinic is set up to manage patients with various storage disorders such as Pompe disease or mucopolysaccharidosis, also known as MPS. Most of the conditions that we see are treatable either through dietary modification, supplements, or enzyme replacement therapy. The team that we have here includes myself, a genetic counselor, as well as a metabolic dietitian. In addition to all of that, we are also a referral center for the California State Newborn Screening for metabolic conditions. As part of that, we therefore get referrals for patients who screen positive for newborn screen and help with the evaluation or the diagnostic studies. For those that are determined to be positive, we will see them in our clinic and help to manage them to get them started on treatment at the earliest possible time. Please, if you have any questions about our program, feel free to give us a call here at the Mind Institute.